Sorry, Jenny.
That's okay. No worries. That's fine. So my name is Jenny Ray. I am a physical therapist at Rehab Specialists here in Los Angeles. Some of you may also know me from my social media, mybreastysays.com. That's an online resource, Facebook, Instagram, for breast cancer survivors. And today we're really excited because we have Aimee Sachs from Sharsheret joining us. And Aimee, please jump in if I don't get all the details right, but Sharsheret is a national organization supporting women with ovarian and breast cancer, correct?
Women and families.
Family,
and then we also, in addition to breast and ovarian cancer, also support people facing the genetic predispositions towards those. So if somebody's considering genetic testing or they've gotten genetic testing done and want to talk about next steps or options, we're here for that too.
And is your title a social worker or licensed family therapist? What is the?
I'm a social worker. I have my MSW, and at Sharsheret, I'm our California program coordinator.
Okay, so Aimee will be talking, I'll be talking today about some of the physical aspects that are neglected after breast cancer treatment. And Aimee is then going to chime in about some of the mental aspects and how Sharsheret plays a really big role in helping that. So, okay, I'm going to share my screen now. And let us start the presentation. Okay. Where's the start button? Oh, I'm so sorry. This is embarrassing. Where's the start slide? Edit file.
Under slideshow on the top.
There it is. Thank you. Sorry. Okay, play.
No problem. Okay. If anyone has any questions too, feel free to type it in the chat. Both Jenny and Aimee will be able to answer as well.
Yes, we like to think of this as pretty informal. Please go ahead and just chime in with anything. So breast cancer and physical therapy. The average 10-year survival rate for women with invasive breast cancer is 84%. And with invasive cancer located only in the breast, the 5-year survival rate is 99%. So the reason I put these statistics up here is just to kind of just sort of point out that it's women are going to survive with breast cancer. I mean, knock on wood, for the most part. Like that's not like how it had been even 10 years ago. Like I feel like the paradigm is shifting where you're diagnosed with breast cancer, you're going to go through treatment, and your likelihood of survival is so much more than it had been. However, what we haven't caught up to in healthcare is the fact that what that survivalship looks like. So it seems like we're still a little bit at that, all right, here you are, you're surviving, but we don't have in place yet the like, okay, so how do we make that meaningful? How do we help with the symptoms and all the things that you've just went through from breast cancer treatment itself, let alone the actual cancer? Oops, here we go. Okay, so breast cancer and physical therapy, like just talking, can leave women with a multitude of issues. And we physical therapists are really the experts in rehabbing patients back to their best selves. So for example, like imagine a patient had a stroke, and this is a really easy concept to think about physical therapists and strokes. So imagine like they have a stroke, they go to the hospital, and the hospital removes the clot, right? So a stroke is when a blood clot gets into the brain or cuts off blood supply to the brain. And never would like the patient go to the hospital and they remove the blood clot and then they say, our work here is done, sir, just go home. And you know, because after a stroke, there's a great chance half of your body isn't working, or maybe your body's working, but your speech is strange now, or is struggling with your speech, or maybe you can't walk. But the way our healthcare system is set up, that if you're that patient who goes into the hospital with the stroke, they take care of the clot, and then they have a whole team in place to help you then transition and help then fully rehab back to who you were before the stroke. They've got the physical therapist, speech therapist, they can have someone come to your home, like it's all set up. Unfortunately, there is no such standard protocol with breast cancer. And that's where we think we can really help fill in some of those gaps. some common side effects of breast cancer treatment. And by treatment, I'm talking about like, the surgery or either the lumpectomy, mastectomy, biopsy, chemo, radiation. Some of those are the shoulder issues after surgery, scars in general. Fatigue is a big one, and that can be for a multitude of reasons. Pelvic floor issues, which pelvic floor issues in general aren't really talked about much, let alone in a breast cancer diagnosis. And then lymphedema. Side note, guys, I'm an East Coaster and I just caught myself getting into that, like talking really fast. So I apologize. Please, if you need me to slow down, I think I can take it, but let me know if I need to slow down. Okay, so after surgery care, the ways that PT can help. Again, surgery being like the lumpectomy, the axillary lymph node diagnosis. With ovarian cancer, it could be if you have to have a hysterectomy or an oophorectomy. We can help with stretches, just helping get your shoulder motion back. We do that through teaching you stretches, doing some exercises together. We can do some massage. Sometimes even the education part, just letting someone know that, no, it's okay to start using your arm, or it's okay to start going for walks. Like just giving a patient permission to use their body can be very powerful when the surgeon or the doctor might not have said that so as specifically as you need to hear it. Scar management is also something that physical therapists are great at. Scars, I think most of us kind of think of them from a cosmetic appearance only, and there are certainly things we can do to help them look better and minimize them so they're maybe not as raised or as bumpy and red, but they also can be sensitive to touch, and we can help with that so it's not so painful to get a hug from your kid or lie on your side. So we can help kind of get rid of that sensitivity. They can also sometimes limit lymphatic flow, like if they're really stuck. So we can help loosen that. And then I also like to kind of just explain with scars, if I had a tear in my shirt and I stitched it back up, you can kind of see those lines. And that pulling, it, can explain why like your scar's here, but then you move your arm and you still feel restricted. So we can help with all of those issues, making the scar softer. We do this through special manual techniques, like different types of massages. There's tape we can use. We even have a laser, which sounds a lot more fancy and dramatic than it is, but the lasers work really well. Yes.
We had a question. So do we do any cupping for scar therapy?
That's a great question. We do cupping. We have cupping sets at the clinic. I personally, I don't think cupping would be my first go-to for a scar, mainly because scar tissue is not as well vascularized, meaning the blood supply isn't as robust as in like non-scar tissue. Cupping really works by kind of like lifting up the skin and kind of like increasing the blood flow. So it wouldn't be my first go-to. If someone had a lot of radiation fibrosis, which we'll get to, in the skin, it's been like long enough years have gone by, I might use a little cupping there, but so it's not contraindicated, meaning it's not something that's like a hard stop cupping in scars. But personally, I think there are other modalities and techniques that we would use first that might be more effective. Great question, though. That's a really interesting question. So cording, which you can see in this picture in this woman's armpit, that happens typically after axillary lymph node surgery. And it happens because there's an incision somewhere in here. So it's not even because a lymph node was removed. There was a case study where I believe it was a man had a mole removed somewhere in here. So they didn't go into his lymph nodes. They just kind of, took the mole off from his skin, and that caused cording. I've also seen cording in women who get the port put in their upper arm. I've seen cording come from that. So it's not the actual nodes per se, but more the location of where the surgery is. They're harmless. Like there's nothing particularly scary about them, but they can hurt and they can limit your motion. The good news is eventually they go away. They don't last forever. If you get cording, it's not like you have it for the rest of your life. They typically will go away on their own in like 3 to 6 months, but there's plenty of women who then they can like show up again. You know, like you haven't had cording for 6 months and oh, look what's back for no really good reason. And in physical therapy, we can teach you stretches. We can do some hands-on techniques to try to soften them and get rid of them. I have them listed here as weird scar tissue. And that's because we as like healthcare physicians, scientists, whatever, like the healthcare community doesn't totally know what cording is. There's some different types of cording. This woman here, she's like kind of this classic look. And there's some thought that the veins in the arm, like the veins themselves become inflamed and then get stuck to the surrounding tissue. So suddenly the veins almost become like Velcro-y and stick to the tissue. And those are interesting because you can see them. Well, interesting if you're an anatomy nerd like myself, but you can like watch them like, oh yeah, look at that. It's following the pattern of the ulnar veins and nerves and things. Or they can be more webby, where they're like this woman in the picture is a really nice line. Sometimes they're more webby and they're less defined. And that's typically when the lymphatic system gets Velcro-y and attaches to its this tissue and stuff around it. Risk factors for developing cording is just having surgery. So the more, if you have to go in, they have to go in twice, you know, like a second time to get more nodes, or if they maybe only went in once, but they really, the surgeon was like, yeah, we really had to dig around in there. That can increase your risk of getting cording. A seroma, which is like a ball of, I guess balls are, it's like a pocket of fluid is the way it often described. If you have a seroma, that can lead to it. If you're, we tend to see women who are like thin, lanky, tall. For some reason, they are more at risk. A really weird statistic is if you have both, like a mastectomy on both sides. So you have, say this is the involved side, your left side, and then the right side gets a mastectomy, that person's more at risk for cording. Why the right side has anything to do with the left side or vice versa, I couldn't tell you, but that was really interesting. And then very important, this is not a risk factor for lymphedema, although we mentioned lymph nodes and we mentioned the lymphatic system in this slide. It's nothing to do with lymphedema, so no worries about that. So after surgery care for a mastectomy, we can help just increase the range of motion of the shoulders. We can help soften the scars, improve posture. You know, a lot of times we can really improve, I mean, all of us, mastectomy or not, need posture help. But, you know, if you imagine you had surgery to your chest, or even if you had abdominal surgery, I know this is mastectomy, but if it's a oophorectomy, hysterectomy, there is the tendency to kind of like protect ourselves in like a rounded posture. So we can help improve that. There's oftentimes too, any neck or upper back pain, like just sore muscles from just being in this new position, kind of protecting yourself. And then if there's any lymphedema in the trunk, sometimes we do, and I can talk about more of that later, but we can help with that, get rid of any of that. For reconstruction, so had mastectomy, we'll talk quickly about some options for reconstruction. The first is a breast implant, and that is what we see most often right now in Los Angeles. Like most of our women, they have their mastectomy and then they have an implant placed underneath their big chest muscles, the pec muscles. The flaps, autologous or flap, so autologous, I might not be saying that, putting the syllable in the right place, but that basically means using your own tissue. That is, there's two main types we see. One is either the DIEP, the DIEP, or the TRAM. That's when we use tissue from your tummy. recently in Los Angeles, again, because a lot of this is really regional, like what the insurance companies pay, what the surgeons are experts in. In Los Angeles, we're starting to see a little bit more of the DIEP. That's where they take some of your tummy tissue, but not the muscles, and use it to construct a breast. We're starting to see less of the lat flap. So that's the latissimus dorsi. The lat muscle is kind of like back here. And so it's part of our shoulder muscles. And it's a big muscle. If you imagine, like, if you look at, I'm going to say a guy because they have bigger muscles, but if you see, like, look at a big muscly guy from behind, it's that, like, that part that gives him that nice inverted triangle look, like that big muscle. Part of it gets flipped around and that becomes a breast. So sometimes, like, why would someone choose these? That could be someone who had radiation in their skin over where, you know, like they're not a good candidate for the implant. Like the skin just isn't strong enough after radiation. Or some people just don't like the idea of putting something foreign in their body, such as the implant, and they would prefer just to have their own tissues. I've never seen one around here, but they do also, in addition to the lats in the deep, there's a butt flap and like an inner thigh flap, but yet to meet anyone with those. So, okay. So the implants, those can be above the chest or underneath it, kind of depends on the woman's body type. Usually the doctors use expanders before the implant. So if you imagine anatomically, we have these chest muscles, and they typically are the breasts we were born with, live above those muscles. If you have a mastectomy, the breasts are removed, we're left with the muscle, and then the implant goes underneath that muscle. But that muscle has been living its life against your rib cage and against your chest. So the expander is inserted to help make room between the rib cage and the muscle for an implant. It creates a pocket, that's what I was saying. So we can help make this phase easier on patients by helping to assist in stretching the muscles, getting your shoulder motion back, and just in general, decreasing pain. So more about the flaps, and I kind of talked about this already, but so tram flap uses abdominal muscle, and the deep flap uses abdominal tissue. The deep part, see if I can get this right, is the deep, I can't, it's the deep inferior epigastric perforating artery, I think, something like that. I should stop volunteering to explain what that means, because I always get tongue-tied. But anyways, the deep flap uses abdominal tissue and no muscle. So as physical therapists, I mean, if it's possible, I would recommend the deep over the tram, because, you know, we need those abdominal muscles for a reason. So if you can leave the muscles in place and take some of that tissue, better. Some things to think about, those, your abdomen also needs to recover. So it's a longer surgery than just getting the implants under the pec. And you're going to have bigger scars, because you'll have this scar for creating the breast. You'll have a big scar, bigger than low like a C-section, but larger than a C-section. So it's a bigger recovery. If you think about when I spoke earlier of how with upper chest scars, we want to go like that. If with a tummy scar, like you're just kind of that even more so wanting to round. So like these are not insurmountable issues, and a lot of people do amazing with that. They're just other sort of considerations to think about. Lat flap, like I talked about earlier, uses your shoulder muscle to create the breast. And again, just like I was saying with the tram flap, like if possible, if this was my physical therapy advocation, if I was in this situation, I would not choose the lat flap either, because we, again, need that muscle. Like it's that like whole using like, what is that? Robbing Peter to pay Paul. You know what I'm saying? Like we need that muscle to do another job. But, you know, there are women who have it done and they do great with it. Sometimes that's the only option. And, you know, we make that work. Like that can be a really great option for women as well. Okay. So
Honey, we have one question.
I love it.
So is crackling or popping in the shoulder common after a mastectomy or an implant reconstruction? We have someone who is about a year out from reconstruction, has range of motion, but has some of that shoulder cracking.
Yes. So what I see happens a lot in the clinic. So to talk about, and Sabrina, you guys can see me, right? Like, even though I can't see myself right now.
Yeah.
Okay, good. So, all right. So a quick little thing about shoulder anatomy. So like, if here's my arm, like here's my shoulder attached to my body. Okay. So the shoulder by design is kind of a wimpy joint. And what I mean is like, it can move in all directions. Compare that to say the knee, which just goes like up and down, like bend, straighten, like the shoulder has to get all different directions. So what often happens after a mastectomy or reconstruction is because now your pecs are a little bit tighter, it can be super easy for the shoulder to sit a little bit in the wrong place. So if it's supposed to sit like back here, we call this the fossa. The fossa, it's like the little cup that the shoulder and the arm sit in. So if it's supposed to kind of sit right center, it can sit a little bit in front. That can be a reason why you're hearing cracking or popping, because it's a long answer. It's like the biomechanics of your shoulder are just slightly off. And with shoulders that slightly off can lead to like a tendonitis, or it can eventually lead to pain. Or you might feel too that these muscles hurt or get tired or tight more often. And that can be too, because if your shoulder's not working as perfectly as it did before, those muscles jump in to help. You know, the brain says, I need to reach here. And if the shoulder's tight, the body's like, all right, we got to figure this out. Okay, let's just shrug. And now I can reach. So I'm reaching the thing I need to reach, but at the cost of tiring out these muscles. So that's actually a pretty common thing. And again, I think can easily be missed because there's so much else going on. But that's a really great question. I hope that answered it. Okay, so to talk about radiation, so we can help prepare for radiation. So oftentimes the sort of chronology for going through breast cancer treatment is to have this, do chemo, have surgery, and then radiation. And so right after surgery, as mentioned before, your motion might be a little bit limited. So we can make sure you have enough shoulder motion to assume the radiation position, which is usually, depending on where your tumor is, it's something like this, kind of somewhere out there. And we can also treat you during radiation if needed. And what we do for that is we help keep the shoulder motion, because typically there is some loss of motion. But our top priority during this time is just to keep your skin happy. So as radiation progresses in the skin, if it, the skin might become a little bit delicate, we are not going to like massage right over that skin. It's just like, imagine if you had a sunburn, you wouldn't want someone to just start massaging your sunburn. But we can work in other places that are not receiving the radiation, like up here or the back part of your shoulder or whatever. But, I always say to women, if you need to take a break from PT because your skin is just going through the ringer, that's fine. Like that's totally fine. We will get that motion back when your skin heals. We just want to make sure the skin stays happy. After radiation, we can help restore any loss in shoulder motion, this guy is saying. And we can break up the radiation fibrosis. Back to the question about cupping, this could be a time we might use cupping to kind of loosen up some of the scar tissue, or fibrosis is kind of like a fancy word for scar tissue, I guess. It just means like, you see this particularly if someone had a lumpectomy and then they had radiation to their breast. So we all kind of know or remember how like a breast feels, or say, I don't know, like your arm, like it typically at rest is kind of squishy. If you have radiation to that area, it might feel really hard. Like instead of pressing and feeling like a squish, it could just kind of feel hard, which can actually kind of be alarming. Because I've had some women who are concerned that there's a new lump, when really it's just, they see their doctor, they confirm, nope, it's just radiation fibrosis. But we can help break that up with different types of massage techniques. Okay, fatigue. So I saw this on the American Cancer Society's website and I stole it from them, which is why I put their little symbol here, because I just really loved how they differentiated between weakness, which is when our muscles are not as strong as they used to be, and that can, making it hard to use them, such as like my leg muscles are weak because I've been in bed for 6 weeks and now it feels hard to go up the stairs. And when I walk up the stairs, I actually feel tired. Fatigue is different than weakness. Fatigue is an extreme feeling of tiredness, lack of energy, despite getting enough sleep or resting. There's so many reasons a cancer patient can feel tired. Part of it can be weakness. Yeah, so there's lots of reasons, but PTs we can help you with this. And excuse me while I step on my soapbox for a moment, but this statement right here, that PTs can help by prescribing progressing appropriate exercises. A pet peeve of mine is how a lot of the medical community will say to one of their patients, oh, just go exercise. Like, oh, you're pre-diabetic, just go exercise. Oh, you finished cancer, just go exercise. Like, as if that is the easiest thing in the world to do. Over pandemic time, my husband and I got a Peloton, and I've been taking these Peloton classes. Like, I'm a class taker, because if I go to the gym by myself, I'm like, meh, good. I just leave. I just don't really, don't tell the other PTs, but I don't actually enjoy exercising, but I know it's important. So we got a Peloton, and I've been taking these classes, and what I noticed is there's always a handful of exercises where I think, who on earth do these instructors think are taking their classes? Like, simply other Peloton instructors who are in amazing shape like they are? Like, no, like most of us are, maybe middle-age-ish, or maybe we're just starting to get in shape. Like, we're doing it because we're not in shape already. And so I kind of like laugh and roll my eyes at these insanely complicated exercises. But as a physical therapist, I know how to like amend them, like to kind of make them work for me so I don't hurt myself. And at some point in the future, actually, and now you guys are on our webinar list, we're actually going to do a webinar series about how to exercise like a PT. Like, how do you strengthen your core without hurting your neck? Like, that was something that took me years to figure out. How do you do legs without hurting your back? Like, all of those things. So anyways, step off my soapbox. But if you ever find yourself in the situation, or a loved one is in the situation of just go exercise, ask them to get a prescription for physical therapy so we can help them do it safely and make it like reasonable and attainable. So by exercising, this can increase your strength. So back to the going up the stairs example, like if your legs are stronger, you'll be less tired walking up the stairs. And then benefits in general of exercising, it's going to increase your endurance. So you can maybe go up and down the stairs twice without feeling out of breath, or you can get your grocery shopping done without being tired. It helps build bones. And a lot of the estrogen positive cancers, you have to take away that estrogen to treat it, which can increase the risk of osteoporosis. Oops. We can improve balance. So if anyone has neuropathy in their feet from chemo, physical therapists we're not great. I don't know if anyone's great other than like different medications, but it's hard to take away those sensations. So we can't necessarily take the tingling away, but we can improve the balance. That like tingling can also mess up your balance, but we can help your balance get better. Exercise can be good for weight loss, and we'll put a little pin in that. We'll talk about that with lymphedema. Decreased risk for lymphedema, speaking of the devil, and then also just improve mood, sleep. It's like basically exercise is like, if there was a wonder pill, it's exercise. All right, shameless self-promotion alert. So every Tuesday at noon, I do a sit and fit class. It's free, and we'll send you the link if you'd like to join it. But this is a class for you, anyone you know, your parents, anyone in active treatment. So back to my lecture about Peloton instructors being insane. This is a class for those people who are like, I am not even appropriate to even think about a Peloton class. I haven't worked out in so long. I don't even know where to begin. So we do this class. It's in a chair a lot of the time. We work on balance. We just work on stretching. So it can be a really, really nice place to start for those who have no idea where to start. Okay, pelvic floor dysfunction. So this occurs as a result of menopause, being kicked into menopause, or a lack of estrogen. And what some of the symptoms can be a tightness in the vagina, like just feeling tight, we can give different stretches, and these can be done. We do have, I'm not one of them, but we do have staff of coworkers at Rehab Specialists who do internal work. Sometimes it's addressing the tightness with different internal stretching with dilators. Incontinence can also occur for either of those, menopause or lack of estrogen. And incontinence, while it's common, it's not normal. And that's kind of something in the women's health physical therapy world that kind of like bugs us, is the way like poise or like different, or doctors, or I don't want to blame doctors, but society, I guess, treats incontinence and leaking as like just what happens when you get older. And that's true. It can happen when you get older, but so does losing your vision. And we all get glasses. It's not like we all just read like this for the rest of our lives and just say it's because I'm over 40, so now I read like this. So just like you get glasses for vision, there are things we can do to help incontinence other than just giving you like a sanitary pad to wear. Like there's definitely things. So another little soapbox, sorry, my soapboxing like crazy today. Okay, pain. So if the tissue in the vaginal area is dry from a lack of estrogen, that can make and tight and dry. That all of those can lead to pain. So pelvic floor physical therapists can help with that. I put at the end here this dryness ... sort of. We cannot we can't give back the natural lubrication that comes from estrogen in the body. We can do some things like, we are the experts in lubes. Like there's so many different types of lubricants, and some of them there's actually like have different pHs, which matter. Like who knew that? So there's some also that can help with pain. So there's some different brands of that. So we are an expert in educating about different types of lubricants. There are some other things on the market, like the Mona Lisa laser, if anyone's heard of that, that some OBs in the area do. Those can be expensive, which is the downside. Some women say they're really helpful. So there are some things we can do to help there. And okay, now we'll talk about lymphedema, and I'll try to get through this quickly. So the lymphatic system clears the junk from our body. And it does this using free ways to move the fluid. So if we think of like, here's the picture of the body, obviously here's rush hour traffic, pre-pandemic. It like uses all these green pathways to take like the junk from our toes, and then that junk gets into the green pathways, and eventually it ends up in the blood, like it gets filtered through our blood. And when I say junk, I mean things like if you worked out and there's lactic acid buildup, or like cells die, so like dead cell bits. If you have you get a cold and bacteria comes in, like bacteria could be another example of junk. Real medical terms here. So along the freeway are toll booths, and those are the nodes. So just like a toll booth is only on specific parts of the freeway, nodes are also in specific parts of the body, such as the armpit, the groin, the abdomen. So where you see those like little dots, those are where the nodes are. We are all born with like a limited number of nodes. It's not like a starfish where like you lose a leg and it'll grow back. But there's no standardized number. Like we don't all have the same amount of nodes. So I want to say in the axilla, I've heard women having up to like 40 something removed. So I kind of think around 40 or 50 is like the average in the armpit. But yeah, it's not that like we all have 10 toes. We don't all have like 10 armpit lymph nodes. Okay, so what the nodes do is they check the fluid for anything suspicious. So as like a car driving through the freeway gets stuck at a toll booth, or probably more accurate, stuck at like customs, they're checking to make sure there's no gun smuggling or whatever. So as fluid is going through our lymph nodes, the lymph nodes are checking to make sure there isn't a bacteria, a virus, or anything suspicious. If there is something suspicious, that's when they are like, oh, something suspicious. They kick off the immune response. It's when our white blood cells start to increase. The lymph nodes might get swollen. A common lymph node experience we've all had is when we say, oh, I'm sick and my glands are swollen. Like those are actually the lymph nodes doing their job from something that came in through your mouth or your nose. Those guys have been triggered. and they're swollen and alerting us that something's going on. So cancer treatment can disrupt the lymphatic system in two major ways. The first is by removing some of those lymph nodes, and the second is by damaging the freeways themselves through radiation. And just like in that last example with the cars, if we think of the cars as fluid in this case, when the fluid backs up, that is lymphedema. Okay, so I'm going to show you next a picture of lymphedema, but before I show you, I want to say, you will never wake up looking like this. Like, this is someone who has had lymphedema for months to years and has never had any treatment. Okay, so I just want to start with that, because oftentimes it's these sort of pictures that we see on the internet. Like, we never see the mild pictures or how it starts. We see these really scary, extreme pictures. So please note, this is the extreme version. But so the reason, aside, like some of the maybe non-obvious sides of why we don't want lymphedema is, you know, there's a cosmetic issue, but also the skin itself can get thicker. It can change texture, it can even change in color. And when our skin is stretched out like that because it's swollen, it can't do its job as well. And the skin is our largest organ, and its major job is keeping out germs, bacteria, like the bad stuff in our environment. So when the skin is stretched out, it's easier to get an infection. And if your arm or limb is that much bigger, it can be hard to move the limb and care for it. Okay. So how do you prevent lymphedema? The reality is you can't 100% prevent lymphedema, but there are things you can do to minimize your risk. So there are 4 main risk factors that research has backed up. And for example, there's other things we used to say, and I'll get to those in a minute, but the 4 main ones that we can point to research and say, these are the 4, are radiation, the amount of lymph nodes you've had removed, if you get an infection, and then obesity. So obesity in this case is designated as if your body mass index, the BMI, is greater than 30. If you don't know what your BMI is, just Google it. Like, just type in BMI calculator and something will come up. You just need to know your height and weight, and it will tell you what it is. I like to put this in here because also living in Los Angeles, it seems like it's really easy to think that you're overweight because of all the crazy glamorous people that live around here. But it can be nice to like type in your BMI and be like, oh yeah, no, I'm fine, I'm healthy. Okay, let's see. So what we can do is some of these risk reducing behaviors. And the reason good skincare is the first one I'm mentioning is, you know, I mentioned the skin's job is to protect us from bad stuff out in the environment. If our skin is swollen, it can't do that quite as well. So, or the other thing, after breast cancer treatment, it's really common to have dry skin too, just again with menopause, the lack of estrogen. So dry skin also isn't as robust and strong as moisturized skin. Like, if anyone has lived in you know, through a winter, like, you know, our skin gets dry, then it cracks and it bleeds. So the simplest thing to do is if you do get a cut, and that is speaking of the involved limbs. So if I had breast cancer in my left breast, had radiation, lymph nodes removed on the left, this pertains to the left arm. This doesn't pertain to my legs. It doesn't pertain to my right arm. But if my left arm gets a cut, a paper cut, a kitten scratches it, what have you, I'm just going to go clean it immediately and then cover it with a Band-Aid, maybe put a little Neosporin on there, versus what I think is, maybe I'm just lazy, but I'm, you know, I've done, okay, you know, and then like go on with life. Don't be like me, go wash it, because getting an infection can trigger lymphedema. Also keep in mind too, depending on how far out you are from treatment, your immune system might not be as strong as it used to be. So where a little cut, you know, 10 years ago might not have led to anything, now suddenly like a little cut could lead to an infection. Oh, here's the, okay, so there's an example of the BMI calculator. And back to my soapbox before about exercise, just ask for help. And the same goes, I think, for nutrition. There's so many different gurus out there saying what to do, like it's a keto diet. No, it must be vegetarian. No, it must be vegan. No, it must be all bacon. Like, there's crazy things out there. So ask for help for nutrition too. how do I know if I have lymphedema? So what I would say is you're going to just kind of routinely check your arms for size difference. And here is a way to do it. One is just kind of daily getting into looking at like the back of your knuckles, like your hands, and seeing like, oh yeah, like both hands, I can see some veins, I can see some tendons. Okay, cool. Then flip over and look at your wrists. And on the wrists, you should expect to see like, they should more or less all look the same. Like, and when I flip my wrist over, I can see some creases, I can see some veins. Okay, you're looking for a difference where you're like, oh, this wrist seems a lot smoother. I don't see any creases over here. Like that could be a sign that this is a little different. The third way to look is if you bend your elbows up in the air, look in the mirror, and then like this should pretty much look like this. Sometimes for some women, lymphedema starts and really just stays right kind of by the elbow. So by bending and looking that way, you can see. If you do notice there's lymphedema, don't panic, call your doctor, call your friendly lymphatic therapist, and we come in and see us. And what we will do is we'll measure your limb. So we'll figure out just how big it is. Based on the measurements, we'll do a different, slow down. Based on the measurements, we will then do some massage to help reroute the fluid. We might need to bandage the limb to make it smaller, and those bandages look more like almost like ACE bandages. So we would bandage the arm up so it looks almost like a mummy, and then we do that for anywhere from like 2 to 6 weeks until the arm is as small as we can get it. And after that, then you wear these compression garments. Some women come in and they feel a little bit of fluid and it's not so swollen that we need to do this whole bandage situation. We might be able to go directly to just a sleeve. Let's see. Actually, before I give you the gift, there's just one other thing I want to talk about, which is just one more thing about the sleeve is if you are at risk for lymphedema, but you haven't developed it, you don't necessarily need a sleeve to travel. An old bit of advice was everyone who's ever had a lymph node removed or had radiation, even if you've never had swelling, everybody must get a sleeve to fly and to exercise. And that bit of advice, a lot of doctors heard and still say, and it's a little bit outdated. And to be fair, like to be a lymphedema therapist, it's 135 hours of training. There was a study, most doctors get 30 minutes in med school. Like they just don't, there's not taught this, which is unfortunate. But so if you hear that, like, and you have questions about, do I need a sleeve? The best recommendation is to like reach out to a lymphedema therapist. And then we'll talk about all your risk factors. You know, now it's not as cut and dry as yes, you do need one. You might not, and there's pros and cons to having one and not having one. So just kind of wanted to touch on that because that is a big question that I get a lot. Diaphragmatic breathing, I'm going to pause on this because I've talked so long, but diaphragmatic breathing is a great exercise because it stimulates your whole lymphatic system. It helps us relax and it can be great for bedtime. But I'm going to stop that so poor Aimee can get a word in. Sorry, I tried to edit this down and it still was long.
Don't apologize. I've seen you do a similar presentation before, and I still feel like I learned new stuff.
Thank you for
I think it's just so wonderful. And you know, at Sharsheret, we speak to so many women who are curious about physical therapy, and so it's just so wonderful to learn more from you, so that I can pass that along.
Oh, that's very kind of you. Thank you.
Absolutely. Okay, so I'm going to share screen. And here we go. So thank you so much for that lovely introduction. You already spoke a little bit about Sharsheret. So here's our mission statement so people can see, but please, if you only read one part, know that it's the bottom part that I want everybody to know, which is that while of course, we are a Jewish organization, we're proud to be a Jewish organization. We are here for everybody regardless of background. So you do not have to be Jewish to call Sharsheret. We started as a Jewish organization. We're still guided by Jewish values. And for our Jewish callers, we can give, a little extra Jewish bit to them, but we don't bring up the Jewish part. That's really just for people to decide if they want to talk about that, they can, but they don't have to. It's about 25% of our callers do not identify as Jewish. So, when we're talking about, sorry, somebody's in the waiting room and it just like popped up on my screen. When we're talking about the emotional impact of breast cancer after treatment, a huge factor is social isolation. This is really the reason Sharsheret was founded. Our founder was diagnosed when she was a young woman with young children. She was still a high-powered attorney commuting every day from New Jersey to New York. And when she went to cancer organizations at the time, she was surrounded by people who were, retirement age, and it just wasn't, it was further isolating. Cancer is already isolating. And then, add in, cancer at a younger age or cancer during a pandemic. There are so many isolating factors. And so being able to connect with other women, who have gone through similar things through Sharsheret or otherwise support groups, anything like that, is really, really uplifting and reassuring and, feels good. But it also, as this study that I have on the slide showed, it actually, not only helps your mental health, but it actually helps your physical health too. So not just avoiding depression and making you feel better emotionally, but even effect on disease progression and immunity. That study showed that it wasn't even just finding the social support, it was the actual act of seeking the social support, which when I read that, I just thought that was so amazing. And it really feels true to me that just, asking for help, just looking for help is sometimes the hardest part, but it actually makes a difference right then and there before you've even made the connections. So Sharsheret really strives to give a sense of community. And that's not only, through our programs, but also just through one-on-one talks with our callers to remind them that they have their own community. So when I talk to somebody, I always say, I'm so glad that I can now be part of your support system. And that's really true. I really am glad of that. But also to remind them that they have a support system that they can call on, but that they have to decide what's right for them and that, they call the shots. Because community can really be a double-edged sword. It can be triggering, even to sometimes get Sharsheret emails can be triggering for people, or to join a Facebook group. I send so many people to My Breastie Says, and Sharsheret also has Facebook groups for our callers, and we also have Facebook groups for caregivers as well. And, I always tell everybody, join these groups, but hide them from your newsfeed because you don't need to be reminded of cancer when you don't want to be, and it is okay to tell your friends and family when they're trying to do the right thing and check in on you. It's okay to tell them, you know what, I'm trying to have a cancer-free afternoon. Let's not talk about it right now, but thank you so much. Ask me again. I'll really appreciate it, but not today. I just can't do it. Or, deciding who to share things with and who not to share things with. So just remembering always that you call the shots in your cancer experience, I think is really important, but that having a sense of community is really, really powerful. So survivorship is a very tricky term. A lot of people never identify as survivors. Other women identify as survivors the moment they're diagnosed, and then everything in between, So we really understand that. And whether you call yourself a thriver or just somebody affected by cancer or somebody touched by cancer, whatever it is, that works for us. And we really we've heard it all before, you know, and we really try to be there for people, and also to help prepare them for the fact that survivorship is a journey of itself, right? So cancer treatment is one thing. The moment you aren't, you know, going through treatment is a whole nother thing, right? So with the nature of trauma, often when you're actually going through the traumatic experience, sometimes you're just in survival mode and you're not really accessing the emotions, you're not really processing your emotions, and that's actually okay. Denial is a healthy coping strategy until it isn't. So, you know, a lot of people call Sharsheret 2 years after diagnosis, 3 years after diagnosis, 5, 10 years after diagnosis. And they say, I thought I had dealt with all of this. Why are the emotions coming out now? And that's the way trauma works, right? For a lot of people. And it makes a lot of sense. So my metaphor that I've been using a lot lately is when you're going through treatment, it's like you're on a battleship and there are, you know, hundreds of people, thousands of people on this battleship, making sure that they're all doing their job to keep the ship going straight. And then when you are done with treatment, it's like you're taken off the battleship and you're put on a raft with no computers, no first mate, no help, you know, and you're just off on a raft out to sea. And it can really feel like that, because all of those people who were checking on you when you're going through treatment maybe aren't checking on you anymore, because they also think like, oh, well, she's done, you know, she's fine now. And that's often not the case for people. So, you know, that's often when people call, and we're here for that, you know, and we really understand that it's different for everybody. It also comes up a lot around scans, right? So scanxiety is that special type of anxiety that comes up when you have your doctor's appointments, or when you have, you know, your anniversary of when you found the lump, or when you had your surgery, or any of those anniversaries. You know, so scanxiety, it's like it all comes rushing back. And that's also trauma, right? That's just like the soldier coming back from war who hears the car backfire and immediately goes back to the headspace of being shot at, right? So it's the same thing. And the difference really is that that soldier isn't on the battlefield anymore, but a cancer survivor is still in the same body that they feel betrayed them. And so it can be really hard. And then you're walking back in the same doctor's office that you were in, you know, the same parking lot, you know, I mean, it makes a lot of sense that those moments are really hard. And so Sharsheret's really here for that in a lot of different ways. And it's,
I'm sorry, I'm jumping in. Can't stop talking. Do you have any like practical tips for someone who knows, like, oh God, my scan's next week?
Absolutely. Absolutely. So one is talk about the anxiety, right? Don't ignore it, talk about it. Always remember that whatever coping strategies you have used for stress before cancer, during cancer, are coping strategies you still have. So whatever tools you have in your tool belt, figure out what they are and really use them. Whether that's a person, whether that's, you know, a song that makes you feel empowered, or, you know, anything like that. Meditation, I just really believe in. I've always believed in it ever since I became a social worker and was trained in meditation, but especially since the pandemic started, I've gone through periods of time where I've meditated here and there for a month or a year or 6 months or a few months or a few weeks. When the pandemic started, I said, I'm going to meditate every day. And I have meditated every day for the last year plus. And so now I speak from even more experience than before, that meditation really, really helps. And the thing to remember is that meditation is not about clearing your mind of all thoughts. I think that's what society makes you think it is. What it really is about getting used to how to deal with those distractions, how to deal with those intrusive thoughts, because that's what meditation's about, is about sitting there, you're listening to the meditation, you know, recording on your phone or whatever it is, And when the thoughts come in your head, instead of saying, geez, Aimee, why are you so bad at meditating? Stop thinking. I've thought every moment of my life that I can remember, right? So I'm not going to stop thinking. What I'm going to be able to do is say, that's okay, Aimee. Of course you're thinking about that right now, whether it's anxiety about my scan tomorrow, or it's just, oh, I just remembered what I want to put on my grocery list. Saying, of course you're thinking about that right now, but right now let's focus on your breath, or right now let's, whatever the meditation is asking you to do, just kindly redirecting yourself. And so what meditation is really about, it's just like working out, right? So you were talking earlier about working out. If I want 6-pack abs, I have to do ab exercises every day, right? So if I want to be in better control of my anxiety, meditation is going to work out that like muscle in my brain. And so when I get used to doing that kind redirection of myself, then when I'm driving to my scan and I'm really nervous, I can say, of course you're nervous, but right now, just focus on getting to the next green light. Right now, let's just pump up the Beyonce and sing our hearts out. Right now, I'm just going to try to count to 10. And then when I get to 10, I'll deal with that then, right? And so I think being present is something that meditation teaches us how to do. And that's like my favorite trick for anxiety. I think also journaling, exercise, all these things that you see everybody telling you over and over and over, I think are really the things that work. But kind of figuring out like what works for you, right? Journaling's not for everybody. Meditation's not for everybody. Therapy's not for everybody, but they're all options. And also calling Sharsheret is a lovely option too. So Sharsheret provides support in lots of different ways. Everything we do is free. Again, I will say everything we do is free. Everything we do is for everybody, regardless of background. Everything we do is confidential and also individualized. So when somebody calls me, I don't say, okay, here are the Sharsheret programs I can offer. I say, tell me a little bit about what's going on with you. And if it's something that Sharsheret can offer that would fix, whatever you're looking for, then great, I'm going to offer it. But I'm also going to send them to other resources too, like my Breastie says, and other things like that. So we have lots of different support programs, whether it's our peer support, which is really kind of how Sharsheret was founded. I mentioned our founder was connected to a friend of a friend, who we like to call Link Zero, because she was the first ever Sharsheret peer supporter, basically, before Sharsheret existed. And we call our peer supporters links because Sharsheret means chain. And so we link women together in a chain of support. And so we offer peer support in a few different ways. We do either one-on-one matches, depending on what somebody is looking for, or we also have private Facebook groups where people kind of get peer support from each other. And that's become very, very active, especially during the pandemic, because a lot of our peer supporters didn't go through cancer during a pandemic. So going to the Facebook groups, finding other people who are going through this, in the last year has been really, really beneficial for people. We have a team of social workers and a genetic counselor. And we know a lot of people are already connected with a genetic counselor through their insurance or their doctor's office. But it's really nice to have one that you can just call and you don't have to bill your insurance and you don't have to, do all of that. And also sometimes that's a really nice option for your family members who aren't ready to go through genetic testing, but are thinking about it. They can call our genetic counselor and set up a confidential phone call anytime. We also do lots of resource referral. We don't provide support groups. So we send people to support groups all the time, financial resources, things like that. We're constantly sharing other organizations because we have such an amazing breast and ovarian cancer community of resources that we're sharing those all the time. We also have kits that we send out, like our survivorship kit, which has, actually have one right here. It's a binder that helps you keep your health records organized. And it is completely personalized based on your specific needs and interests. It also comes with like a cookbook and all different kinds of goodies inside. Our Best Face Forward kit has paraben and phthalate-free makeups and lotions that address the cosmetic side effects of treatment. I get some of my sweetest thank you notes for the eyebrow stencil that comes inside, because a lot of people don't realize, yeah, I was prepared for my hair to fall out, but I wasn't prepared for my eyebrows to fall out, and I don't know how to make new eyebrows. So that's a huge, huge gift that we give. And we also send our busy box and our family focus kit. The busy box is tailored to the ages and interests of each child. And it comes with toys based on that. So toys for each kid. And then it also comes with parenting resources and a storybook that explains cancer on a child's level. And then we also have our family focus kit, which is geared towards, or I should say our Spungen family focus kit, which is geared towards the caregiver. And that caregiver can be, the typical caregiver you think of, the spouse, or it can be a friend or a parent or a family member of any kind. And they don't also have to be in the home. A lot of people think, oh, well, I don't have a caregiver because I live alone. But I send these kits to people who live across the country because it's really geared towards helping the caregiver, whether from near or far, understand what the woman is going through and how to not only take care of them, but to take care of yourself. We also have financial subsidies for non-medical services that are related to mental health. So that is scalp cooling during chemotherapy, cranial prostheses, AKA wigs, and also areola micropigmentation, AKA nipple tattooing to reconstruct the nipple. And then we also, a huge way that people derive support from us is helping us educate their community. So people will bring us to their children's school or their synagogue or church or, their book club even, and being able to tell your story and educate others actually really makes you feel better. And also helps, I always say, I really want to stop hearing, wow, I wish I knew about Sharsheret when I was going through it. So, being able to kind of help other people find out about us really kind of helps add meaning to your own experience in that way. Another way that we've been really creating community, especially since COVID began, is our webinars. So we used to do webinars about 3 to 4 times a year. But now we do like 1 to 2 a week. And they're on a whole range of topics. So I'm very excited that Jenny will be speaking on a future Sharsheret webinar about physical therapy. We are very excited about that, but you can see that we record all of them and they all live on our website forever. I know our website is in the chat and you can go to our website and find this, or you can email me and I can send you the exact link to this part of our website. Here's my contact information and I'll go ahead and put this in the chat. If anybody has any questions, I love when this is a little interactive. So definitely let me know if there are any questions.
Aimee, amazing. That was like, I don't know. I was just kind of saying like, yes, like that. I love the really practical tips that you gave.
Absolutely. Absolutely.
It's Aimee and everybody that's been involved in this talk. It's been so informative, so many resources, so much information. I've been going through this journey for the last 2 years. And it really touched me for you to say, I wish people knew about Sharsheret while they were going through it. Well, I'm still going through it. And I'm so glad that I came on today. And I will definitely be contacting you.
Absolutely.
We're so glad you're here. We're so grateful that you're here.
Absolutely.
Thank you.
Absolutely.
And thank you to everyone who's still here. I know, sorry that we've gone over a bit, but we're we appreciate you being here. This is amazing. This is great.
Yeah. We also I feel like I can speak for Aimee on this one too, but like if there's anything else you need more of, let us know. Like if there's something we didn't cover or something that's like, God, I'm really struggling with blah, blah, blah. If we don't know the answer, there's a good chance we know someone who knows the answer. So
Right.
let us know. That's
Exactly.
Absolutely. And I just wanted to say, because I was in May's Pilates class today, is the way I learned about this. And I'm so glad she said something.
oh, good. She's amazing.
That's
She
wonderful.
is.
Yeah.
I was just about to say, I once, one of our callers once called me her breast cancer concierge. So it goes to exactly what Jenny's saying of like, if we don't provide, you know, whatever you're looking for, we can find it, hopefully. So absolutely. You know.
Yeah, and it's just everything that you guys are doing is amazing. Thank you.
So-
Oh, thank you. That's awesome.
If anyone has any more questions, feel free to stay on. Aimee and Jenny are still here. And then, like I said, if you have any questions, I have all of our contact info in the chat. Yeah, feel free to let us know.
I have a question, sorry. And it was the survivorship, or just, calling yourself a survivor, or whatever you want to call yourself. Sorry, talk.
Right.
Because I was diagnosed in 2018
Mhm.
and went through chemo, radiation, surgery, etc. And then it came back like 3 months later. And apparently it was a clone of the first.
Right, everyone. Well, as Sabrina put in the chat, we do have some more. We do these webinar things kind of often. So, and like you said, or like I said, if anyone wants a deep dive on anything else, just let us know. We can.
Well, now that I've registered, now I'll get the emails as far as the prompts for the other Zoom things. Awesome. Thank you.
Terry, are you in Los Angeles?
Tara or Terry?
Terry,
Oh.
yeah. She said, she asked if it's easy to get
Northern California, but I'm going to be traveling to Southern California, probably moving later this year. So
Terry, write down my email. If and when you need to come and see me, you just let me know and I'll make it happen.
okay. Thanks.
And I also do, because you're in California, we could do telehealth too, if you just had like a bunch of questions you wanted to ask. Like we could do
Okay.
that. Yeah. And then go through, depending on your insurance, we could find out like if we're in network with your insurance and blah, blah, blah. If not, I also do like as a side thing, like cancer coaching, where like, you know, it would be less than what you're out of, like if the out of pocket is too much, like we could do like a cancer coaching thing where you can find something more reasonable.
That's a whole nother webinar Zoom situation about insurance.
Oh God, right?
Out of pocket and deductibles.
I will say Cancer and Careers has really great webinars on that.
Oh, that's good to know. Is that a website?
Yeah,
Cancer
I'll put it right here.
I'm going to be calling you, Aimee. You know I will.
Absolutely, absolutely. I think now that I write .com, I'm like, is it .com? But if you just Google Cancer and Careers, the website shows up. They have really wonderful really wonderful things. And then also my other favorite resource for this that also has webinars, but they just have the best website for all insurance questions is Triage Cancer. They're really fantastic because if you go to resources by location, they have like a map. You can click on your state and then it has all the insurance questions answered for your state. So I know most people on here are in California, but it's a great resource because they have all 50 states represented.
Awesome.
I mean, pretty much it's not a question about insurance. It's just insurance.
Frustration about insurance. I agree.
I mean, seriously, I mean, I'm on Social Security disability insurance right now, so I don't have and my income is very little. And out of just paying for a Blue Shield is over $750 a month just to have insurance. And then my out of pocket is $8,500. So that starts up every year. So this being a new year, in January, when I went for my CT scan, I was hit with an $1,100 bill. Like, oh yeah, you have to pay this today.
So crazy. It's so crazy. Yeah.
Cancer is not cheap.
No.
Right. Just wanted to close it out, but feel free, anyone who wants to jump in at all.
Listen, I could stay on here forever and talk to you later. So
Honestly.
you might as well close it up.
Yeah, email us to set up a time to talk, and we can do that anytime.
I will. Thank you so much for everything, all the
Thank you
information,
everyone
and
for sharing.
resources and everything.
Thank
Absolutely.
you. This is really
Yeah,
amazing.
thank
pleasure,
you.
and
Thanks to everyone.
Thank you
who
so much to
joined in.
everybody at Rehab Specialists for inviting me. I
Oh
just
my God,
Oh, Aimee.
Thank you, Aimee.
I know. We're so glad you could join us, Aimee, honestly.
Thank
Yes,
you.
yes, yes. You made us better. Thank you.
Awesome.
Thanks, everyone.
Bye. Thank you.
Bye. Thanks, everyone.